Ginger has a very long history of use in various forms of traditional and alternative medicine. It's been used to aid digestion, reduce nausea, and help fight the flu and common cold, to name a few of its purposes. Ginger is a flowering plant that originated in Southeast Asia. It's among the healthiest and most delicious spices on the planet. It belongs to the Zingiberaceae family, and it's closely related to turmeric, cardamom, and galangal. The rhizome, underground part of the stem, is the part commonly used as a spice. It's often called ginger root or, simply, ginger. Ginger can be used fresh, dried, powdered, or as an oil or juice. It's a very common ingredient in recipes. It's sometimes added to processed foods and cosmetics. Ginger contains gingerol, which has powerful medicinal properties. The unique fragrance and flavor of ginger come from its natural oils, the most important of which is gingerol. Gingerol is the main bioactive compound in ginger. It's responsible for much of ginger's medicinal properties. Gingerol has powerful anti-inflammatory and antioxidant effects, according to research. For instance, it may help reduce oxidative stress,
which is the result of having an excess amount of free radicals in the body. Ginger is high in gingerol, a substance with powerful anti-inflammatory and antioxidant properties. Ginger can treat many forms of nausea, especially morning sickness. Ginger appears to be highly effective against nausea. It may help relieve nausea and vomiting for people undergoing certain types of surgery. Ginger may also help chemotherapy-related nausea. However, it may be the most effective when it comes to pregnancy-related nausea, such as morning sickness. Studies that included a total of 1,278 pregnant women, 1.1 to 1.5 grams of ginger can significantly reduce symptoms of nausea. However, this review concluded that ginger had no effect on vomiting episodes. Although ginger is considered safe, talk to your doctor before taking large amounts if you're pregnant. It's recommended that pregnant women who are close to labor or who've had miscarriages avoid ginger. Ginger may play a role in weight loss, according to studies conducted in humans and animals. A review concluded that ginger supplementation significantly reduced body weight, the waist-hip ratio, and the hip ratio in people with overweight or obesity. Study of 80 women with obesity found that ginger could also help reduce body mass index, BMI, and blood insulin levels. High blood insulin levels are associated with obesity. Study participants received relatively high daily doses 2 grams of ginger powder for 12 weeks.